how much ability does someone in that position, as the administrator, have to make any changes or reforms, or is it really only something that could come from Congress that would change the change the program in a really significant way?
So that's a great question. And the CMS administrator has enormous ability to influence Medicaid policy because a lot of these state ideas, they are subject to approval
Mhm.
from the administrator. I have been impressed by Dr. Oz so far. I think he's taken principled actions in really trying to protect the program for the most vulnerable, as well as get rid of some of these state schemes. He's done two really all-star actions so far. CMS, this is on the Obamacare side, but there's a huge amount of fraud and waste in Obamacare, and they did a very important rule to expand program integrity and really to verify people's eligibility. That rule, CBO projects, will reduce federal spending by $210 billion over a decade.
Uh,
Now, a lot of that is because of how big the problem grew during the Biden administration, but it was a great first step and a great sign from Dr. Oz and the CMS leadership that they weren't going to tolerate this level of improper spending in the program. And then just yesterday, CMS cracked down on one of the most abusive types of these Medicaid provider taxes. This was a provider tax that California did through their health insurance plans that ended up with the state getting $10 billion of federal money with no state contributions. The next year, California, using all federal money, expanded Medicaid to illegal immigrants in the state and lifted the asset test so that Californians of unlimited wealth can get on the Medicaid program to have Medicaid pay for long-term care.